And welcome, everybody. We are live. Thank you for whoever's coming to our live today with Mr. Midwife.
Welcome, everybody. We are live.
Let's see if I can get rid of that. Oh, is that you? I think
that was me. I'm sorry.
That was you. Just go ahead. Mess up my intro. My premiere event. I can't believe it, Mr. Midwife. I swear.
I apologize.
So thanks, you guys. Today we have Mr. Midwife and I, Liz, I think will be joining us a couple times. Nurse Scott, unfortunately, couldn't make it today. He's grinding away doing his thing with that nurse practitioner program. And you guys watch all those videos over there. There's links below to everything we're going to be talking about. We're going to cover a lot of different topics today. And we're going to be talking about basically what's in the news, what are current events, what's going on. We're going to touch back to some events, other issues like fake nurses. We're going to see the updates on that from a couple states. We're going to talk about a minimum wage for healthcare workers. You might see Mr. Midwife and I spar a little bit about that. Let's see what happens. And then we're going to also talk about, a couple of nurses who've made the news and gone to jail. We're also going to talk about disparity in healthcare, some changes to the organ donor requirements that have been biased against African Americans, against Black people. And then we're also we'll be able to touch on the Joint Commission and this new thing that they're running, where they're going to do a health equity certification, which is really very interesting because, we'll see. That's going to be like an add-on for any hospitals or facilities that are Joint Commission. And then we'll see what else we can talk about, if we have time. Oh, and then also we're going to talk about the nurses strike averted in South Shore, Long Island, in New York. So those are the two top stories we're going to lead with today. So let me see if I can share my screen here. Let's see. I did it before. So let's talk about minimum wage. So California there's a proposal right now. There's a bill to raise the minimum wage for healthcare workers to $25 an hour. Hey, Lori's joined us. Let's bring Lori in.
Oh, hey, goody. She's smart.
Hey, Lori. Oh, good. Good thing we have a third person because, we needed somebody who could bust up Mr. Midwife and I.
Sounds good. I'll take that on.
We need to always, it's always good to have threes because, then you can really, we can really instigate some stuff. Okay. I'm going to attempt to share a web page. So let's just see how this goes. Share screen. Don't show these tips again. Oh yeah, I didn't want that. Okay. So let's see. Can we see this? All right, great. So we got it. So this is the website I just pulled up SEIU-UHW, which is one of the largest healthcare unions in California, part of the largest union in America. And there's a ballot, it's not a ballot initiative, it's a bill to raise the minimum wage for healthcare workers to $25 an hour. And it is, I'm scrolling fast, you guys. It is SB Bill 525, sponsored by Maria Elena Durazo. And I don't know what district she's in. I apologize. But she is from Southern California. So this bill would set a minimum wage of $25 an hour for healthcare workers, and it would cover all workers who provide services in nursing, caregiving, housekeeping, guard duties, clerical, food services, laundry, medical care, and other patient care related services. And I'm going to read the list in case it's a little small to read. The healthcare facilities covered by the bill would include hospitals, urgent care centers, ambulatory surgical centers, skilled nursing facilities, community health clinics, FQHCs, and other primary care clinics, outpatient settings, physician offices, watch out, providers, dialysis clinics, behavioral health centers and integrated health delivery centers, integrated health delivery systems. I'm not even sure I know what that is. We'll see. What I don't see is home health. So there's a couple of carve outs that are probably there, and I'm not exactly sure what those are. I did the best I could to do some research on this. Now I want to give a caveat because I was a union organizer for SEIU when I worked for union, and in Northern California, in the Bay Area, Santa Cruz, Sacramento, San Jose area, that geographic sphere, all the way probably over to Stockton, the wages for union workers that are under contract in hospitals mostly is more than likely almost above this or at this. And that is including, and it may not be the entry level wage, but even food service workers are doing pretty well. But this would really expand it to all industries to more or less, and I'm going to give you my take and then I'll run with it and let you guys go. My take on this is it levels the playing field a bit so that we're not robbing workers from one environment to another and leaving the lower paid workers in areas where there is, maybe a $13, $15 an hour minimum wage, whatever that minimum wage may be, and also without benefits in favor of workers who then go to unionized facilities, which are mostly going to be acute care. There are some nursing homes. There are now some dialysis clinics getting into the fray. So what say you, Team Fanny Pack? Let's hear it.
Go ahead, Lori. You go first.
I think it's interesting that this article does not say nurse practitioners' offices, because this is typical of legislation. They forget that they've made NPs coming up to be a full practice authority, and yet they don't include them in future legislation as well. And it's also the same thing, like how a nurse practitioner can't call themselves doctor, and they forget about them in the legislation.
Mm-hmm. Now, and that's a good point. Now, I don't know, because this is straight off the website. I haven't looked at the actual bill, just full disclosure, you guys, to see exactly the language. Now, I am seeing primary care clinics and physician offices. I would assume that's going to be all provider offices. I'm going to make that leap, but I do not know. I was frantically actually reaching out to folks who were in the know yesterday afternoon. And there's actually quite a bit of information that they have out, and it was actually just a little bit too much for me to run through. Welcome if you're joining us. We're talking about minimum wage for healthcare workers, SB Bill 525 in California.
So I've always had strong feelings on setting high minimum wages like this. Healthcare workers, there's a level of healthcare worker that, we need the money. We need to offer more money so that more people will come into this, so that more people will stay. However, if I'm an RN, and this takes me back several years, if I'm an RN starting off at, say, $28.50 an hour, and then I've got a CNA who's coming in at $25 an hour, that's only a $3 gap. That, to me, why did I go to nursing school then? Why would I get a license, put my hind end on the line every time I go to work? My skills are higher, my responsibilities are far greater, yet they're getting paid pretty close to the same that I am.
Right. So it's a relevancy relative to kind of what the higher skilled respiratory therapists, nurses, RNs, right. And then you have LPNs in the middle there too.
And I don't. My wife was an LPN for years, and she was always in wonder because they pay her $28 an hour when she was doing home health. And she's like, I sit with these kids at home and do nothing for 8 hours at night. I'm sitting here playing video games and not doing a whole lot for these people except watching them sleep. And my rebut to that was always, they don't pay you to do. They pay you to be on standby in case something goes wrong. They pay you for what's here, not necessarily here. So they're paying you for the knowledge that you're constantly carrying inside your head. Now, the other aspect of this is, if I'm a CNA making $25 an hour and there's only that $2 or $3 gap, why would I improve myself? Why would I go on to nursing school? Why would I further myself?
Mhm.
If I can make $20 flipping burgers at McDonald's, why the heck would I go into engineering or do anything beyond that? So to overpay, when I don't want to say overpay, to pay people such high wages kind of disincentivizes doing something, furthering yourself, advancing yourself. And by advancing yourself, you advance society and your family and your kids, and everything is better.
Gotcha. Yeah. And I think that's a very I think I've heard that argument many times. I mean, and I think it's one, well, I think right now we're in a period where people are going straight into nursing, right? There's not many people who are like kind of working their way up. I did not. I actually took a pay cut to become a nurse, and it took me a while to actually build back up to what I had been making. I was a director in a union, so I was doing pretty good. And
Adrian, hate to interrupt you. Liz is here.
all right, oh Liz, there you are. Where'd you go? Where are you? Where is she? Oh, there she is. Sorry, you were off my screen. I apologize.
No, you're fine.
You were like, but no. So I think that this is a good question. So let's like flesh this out a little bit. So, and I don't know what the average starting wage for RNs is in California currently. It varies quite a bit from Southern to Northern California, with about a 30 to 40% difference. So I know when I started in 2007, I started at $26 an hour. Prior to that, when I was working for the union 2 years prior, because I was in nursing school for 2 years, I had been on a strike campaign up in Northern California talking to some dietary workers, a kitchen cook. We were on the strike line. I was running a strike line. And, and he was sharing, some of the workers there were sharing what they were making, right? What they were making was only a couple dollars less than what I started at 2 years later as an RN. However, I did end up at almost $60 an hour 12 years later in 2020 when I left. But again, that's Northern to Southern California, which has a high disparity. So those same workers at the same company, but in Southern California, were making, instead of 18 or 19 or $22 an hour, we're making $11 an hour, 2% a raise a year, for example. And I would say on the issue of like, yeah, and you're spot on about your, what you said about your wife. I mean, it's just like, nurses get flexed, right? Staff get flexed in hospitals, police and firefighters don't get flexed, right? So that is like that to me is a whole other issue. We certainly talk about it. But what do you guys think? Liz is here. Let's hear from our fanny pack leader.
I'm here. Yeah. So, is this in California only?
Yes, this is a bill in California.
But as goes California, so goes the rest of the nation. We know this. So.
Yeah, I would probably say, I mean, I'm very pro like increasing the minimum wage. I don't know how people live on less, like, when we're like looking at, under, I mean, $25 an hour seems like fair in order, like, to me, living in California where the price is going to be higher. I don't think it would decrease your incentive to be a nurse necessarily, because I think you'd probably be getting paid more money as a nurse, right, than the minimum. And if anything, it would, then just don't work there. You know what I mean? Work somewhere that's going to value you more than $25 an hour as a nurse. I would never work as a nurse for $25 an hour. There's so many other, like, the things that you put into it, like for $25 an hour, I would rather go and do other things that, it's just not worth it to me. So I think it's beneficial. I think paying people a minimum of $25 an hour will benefit them in terms of what they're able to do for them and like their family. And I don't know, I'm very much in the pro. I think this might attract people to healthcare who otherwise wouldn't consider it, because a lot of the jobs that they would be taking it, I don't know if they're going to be able to fill them for like less than that, but I don't know.
And that's what I said too. I think a higher wage would attract more people. But if you go up on your wage, and I'm your landlord. I just found out. I know you're a nurse because you put it on your rental application. I find out you got a higher wage. Guess what I'm going to do? I'm going to raise the rent. There goes your pay increase. So unless you can put through legislation that says nobody gets to increase you can't increase gasoline or rent or the price of rice at Walmart or anything else, it always flushes itself out.
Yeah. I mean, I think there's also, so there's that like theory, right? But then there's also the other theory of like, well, the money's actually already there. So we're just redistributing the wealth, right?
Mhm.
It's like the Robin Hood principle, right? So maybe the CEO and the C-suite aren't going to get $30 million raises or bonuses, collectively. It could be something like that. But I think that the other thing is that everything is going up. I mean, I'm from California, so I've lived there my whole life, other than the last couple of years. And I would say that the problem here is that there's a cost of living issue. So I want to point out one thing. The average level 1 salary in California for an RN right now is $75,000, which is about $38 an hour. That's starting nurses. So usually somewhere the lower end is 67,000. And we actually haven't seen, sadly, I wish that the salaries of California were contagious across the country, and they're not. I'm in Virginia, and it's $25 less an hour. Yet the townhouses that I walk my dog by are $900,000 to buy. They're more expensive than the homes where I lived in Ventura, California, at the beach. I don't know who buys them. I don't know what they're making. So we also are in the South, right? If you get in the deep South, the wages are extremely depressed. And so I wish that were the case, but we haven't seen that happen. The only thing that really raises wages for workers en masse are unions and union contracts. And it takes time, right? That's why Northern California, it's not just the cost of living in Northern California, but because they have been healthcare workers have been unionized since the 50s, since after World War II, decades longer than in Southern California, where we started really organizing healthcare workers in mass in like 1998, 2000, around then. But I think it's, what I think of is I think of my mom, who lived in a skilled nursing facility for 9 years of her life, and all the people I know that are in long-term care, and that at the low wages of minimum wage, at the same wage somebody can work at a fast food restaurant, that's then what a CNA, a nurse aide, is being paid, or the fact that even to be like, a paraprofessional kind of role where you're required to have a bachelor's degree, but maybe not a license, they're still paying like $15 an hour.
Mm-hmm.
The job I did in corrections, I worked in corrections for a private vendor, a nonprofit. The pay in 30 years has only gone up like $3.
Yeah. Yeah.
And we had to have a bachelor's degree to do that. We were counselors.
Yeah. All of our MAs at the office I worked at left to go work at Target because it paid them more.
Yeah.
Right.
And I worked a SNF for about a year. Right after graduated school, before I found a job. And I had a couple of CNAs that they're like, I can make more money working Amazon. So they split.
Yep.
And
you
it was
can't blame them.
Get difference. It was like $2.50 an hour difference, which when you're only making $15 an hour, that's a lot.
Mm-hmm.
It is. I mean, I always had multiple jobs. I did landscaping. I worked graveyard in a corrections facility from 11 p to 7 A. And then my friends and I from Long Beach would drive to Malibu and climb down mountains and do landscaping around like bajillionaire homes, and do that till like 5. And then I don't know when I slept. I had a couple hours sleep. I just didn't. I'm in my 20s. I didn't sleep. I don't know.
Caffeine. Got a coffee IV.
Yeah. But I think that, so to me, that's the thing. If the wages are going up in other industries, and we're not getting, can we get a better quality worker? That's the one thing. Can we draw in a better quality worker? Right. I mean, like, for example, like most of us did something in healthcare while we were in nursing school. I did home health, but then I would work doubles, or I would find positions where I was taking care of a couple. So I would get double paid because it was still only $13 an hour. Yet the agency was getting $26 an hour. Right. So, and then of course, no benefits. Right. So there's no benefits to any of this. So that's the other component. If I've got to buy insurance for a family, that really does add up. I think that there probably are some carve outs depending on the size of a private practice. Because we know doctors' offices. I mean, I just was at a doctor on Monday, and I was like, wow, you guys are open. It's President's Day, because I couldn't find anybody else was open. And they're like, yeah, they're always open. I go, do you guys get, holiday pay? No. Right. I mean, so again, well, then those people in that office, you're creating a temporary situation. You're creating a conveyor belt versus like having a dedicated group of employees in dialysis clinics, in skilled nursing facilities. So I think I'd be curious to see. I think it's going to pass. I have a feeling this is a very large local. They have over 100,000 members around the state. The members are very politically active. It includes LVNs, LVNs, what they're called in California, respiratory therapists, radiology techs. I think that it's for California. I think it's appropriate, especially when it's very interesting to go to their website. They have people giving testimonial, and I actually did organizing in San Diego. Quite a few workers, like lawyers, public sector workers that work for the county of San Diego, the city of San Diego, and in healthcare, they live across the border in Tijuana and come and take the train over because it's just gotten so expensive. So I don't know. Any other thoughts on this, you guys?
I'm all for it. I mean, healthcare workers even the CNAs are highly skilled.
They are.
You don't want some guy who flies paper airplanes to be in charge of a Boeing 747 as you're crossing the Atlantic. That's not what you want. So you want to pay them more to attract the better skills. So I'm in favor of it.
Yeah. I think it's clear that I'm in favor of it. Like, if we could pay people and then retain them, because that's the other huge issue, right? Is they come in, they don't get paid anything. And then as soon as you train people and they're great, and then they leave, and who can blame them? Like, I have told them before, people that I worked with, I'm like, please leave and go somewhere better, because you can't, they were doing this and then they were moonlighting, doing 12 other things. And I was like, that's not healthy or safe in any way, shape, or form. Also, Adrian, can we take a technology timeout and figure out how to make our chat visible to people?
Oh, yeah. Wait. Okay. Yeah. How do we do that? I knew I was missing.
Private. I don't think we're being seen by anybody.
Private chat.
There's 14 people here, and it shows up on my YouTube page.
How do I show it?
For normal comments, it says YouTube doesn't support comments on private videos. So I would go to YouTube Studio really quick and make sure that it is not private and that it's not unlisted.
Oh, good Lord. The Lord.
Thanks for being here, friends.
We're
figuring out technology.
All right. Okay.
Now we have here's someone. So whatever we did might have worked.
I literally didn't do anything.
Oh, well, then maybe it's just StreamYard is being funky, because.
But I'm not seeing comments like how there's usually 2 columns.
Yeah. Yeah. It says YouTube doesn't support comments on private videos on mine. But KJ on the YouTube side just said, would this include anyone associated with healthcare systems, or just those doing direct patient care? It's a good question.
According to Adrian, what she just read is janitors and security guards and everything else, right?
Yes.
That anyone associated.
Did I misunderstand?
It sounds like.
Yeah, it is. Let me go to YouTube Studio. So it's security guards as well, which is really important. I mean, again, if you don't have, let's see, hold on. Where's the YouTube? If we don't have like a way to keep people, a retention, I mean, money is just one retention issue. Let's see. I'm going to stop. Oh, let me stop sharing that. Okay. Let me see. Live. I know I set it to public. I took off the private on it.
StreamYard might just be doing a weird.
Maybe StreamYard the setting didn't change. It's public. I have it set for, I switched it to public.
Weird. And we can see a comment popped up. We just can't see it within StreamYard. So it might just be.
I wonder.
So for the chat, if we're ignoring you, it's not because we don't like you.
It's not because we're ignoring. Yeah.
Because we can't see you.
I'm looking.
Technology is not my friend.
Is there some setting in StreamYard I can?
I'll Google it.
Okay.
You introduce your next topic and I'll Google
Okay,
it because I've
cool.
never run into this issue with StreamYard. And
It's
just
a-
as a heads up, I probably have to leave in like 10 or 15 minutes because I have to go somewhere, but I thought I would pop in really quick. Let me
We're
Google
so-
this and see if we can figure
We're
it.
so happy you did. Okay, so our next topic we're going to discuss. Let's see if we can get this. Here we go. Oh, good. It just pops it up. Sorry, you guys. I couldn't find like one that didn't have a bunch of junk on it. Let me make it a little larger. Okay. So the nurses at NYLI Nurses, maybe this didn't reach as many people, were ready to go on strike on February 23rd. 800 nurses at South Shore University Hospital. They reached a tentative agreement. I don't have a lot of details about this. I just happened to catch this last night. This went out yesterday afternoon. So I have a feeling that the city of New York, the employers, the hospitals took a look at what happened in, the main boroughs in New York and thought, we don't want to have any of that. We will settle. Now, I don't know the details. Let's see if the tentative agreement included improvements to and enforcement of safe staffing standards, increases in salary, experience pay to retain nurses, also include improvements to retiree health benefits. Retiree health benefits are a huge thing because once you're retired, and many people don't know this, so once you're no longer an employee, you're technically not represented by the union that you were a member of. So if the company decides to make changes to your pension, it's a very difficult thing for unions to then go back and try and negotiate because the leverage is the members, not the retirees. Right? The retirees don't have any power to really bring on the hospital. So these are, it's like a bit of an honor system, and it's become a little bit common. And NYSNA has been at the forefront of fighting. NYSNA and NNU have really been at the forefront of hospitals who have attempted to change pension plans, or not fund pension plans. Fanny Peck, what say you?
So what you said kind of blows my mind a lot of it. So you sign on to an agreement, and once you retire, somebody can come by and change that agreement that you signed on to, and you have nothing to say about it.
No. And this is the case for any retirement plan, honestly.
That rubs me the wrong way. Kind of the whole ex post facto thing. You can't change the law retrospectively and shove it forward like that. When I retired, I expect to be making $5,000 a month on my retirement, and you can't come by later and say, sorry, we're going to cut that to $3,000.
Right.
I still have rent to pay. I still have medications to get. I still got to buy groceries, keep the lights and gas and everything else on. I've still got to live for the next, people are living so long now, I've got to live for the next 30, 40 years, possibly.
Right. And these are pension. And here's the thing is that most people think when you say pension, they're also going to be thinking, yeah, I have a 403B, I have an IRA, right? We're talking about real actual pensions. And in some situations, these might be public pensions. And then you might run into something like the Enron scandal. If I don't know, probably Mr. Midwife, you and I are probably the only two old enough to remember that. Right. And a lot of public sector workers lost out big. So when these state and public pension plans are mismanaged, that can also be a big loss. But these are cases where hospitals are underfunding, or nobody, until the unions actually check, because again, this is all, so much of regulation is self-enforced, self-regulated. Companies are expected to self-regulate themselves, which we know typically doesn't really work out that well. And so there's not like some periodic, hey, you've got to check in annually and check the funding of your pension, and then the number of people that you're going to pay out. And, actuaries make lots of money to figure all this stuff out. But it's often, 10 years later, now we've realized, that this pension's not funded appropriately. So what do you do?
Well, that's the same dance and song that we've been doing with Social Security for decades. What I pay into Social Security now is what's keeping the retirees alive today. And so it's going to be the burden of my grandkids to keep me alive when I get there. It's not self-sustaining. It just isn't.
If population, and it just depends, and we'll see what happens with population on that issue. But in the case of these pensions from companies, they're not they're funded by the decisions of the corporation, the leadership, right? And where are they going to put some of that money in allocations? And we've seen where, like for example, when EHRs were first coming out, like, I don't know, 2010, around there when they were really the big push, Epic, Cerner, right? A lot of hospitals healthcare facilities had to spend billions of dollars. Mine spent over $2 billion to bring in these big, operations. They had to hire hundreds of people at their hospitals, and they decided, well, we're not going to fund the pension quite as much. Where are we going to get that money?
Yeah.
So other thoughts, you guys?
That's it on that. That sounds like a total. I'm curious to see what else. Did the union cave on certain things? Did they get what they actually wanted? How good was the compromise on some of these things?
That's always a thing. And people will come out and they'll come out and say, well, the union gave up this, they gave up that. Trust me and believe, you guys, if you have a workforce and you have 800 nurses, let's just use this example, and you do a strike vote and 750 of those nurses come out and vote. And out of the 750, 400 say they'll go on strike. You are going to have a weak contract because now you have 400 people for the boss and you have 400 people that are for the union, for themselves. Because whoever's not willing to go on strike is saying, I'll take whatever I can get from the boss and whatever they offer, in very reductionary terms. I'm making it very, very simplified. But that's basically how it's perceived by the union. And that's why it's so important that members are active and understand what's going on and be involved with their union and their contract.
Liz, chime in.
I'm just not shocked at this point. Like, I pretty much expect, I'm like, well, that was a very big douche move. Also not shocked. Yeah. So be careful. Just be very careful.
I'm just, it says they reach a tentative agreement. What's the nuts and bolts?
Yeah. And let me pull this up. I'm going to see if I can, the press release from NYSNA is actually very minimalist and doesn't really say much more than this article does. So I do not know. I feel
like they have to get leaked. When people leak, I feel like that's how we found out all the ones from New York Presbyterian, and when all of those ones, we were getting all of those. That was just from people, I think, sharing them who worked there and who had access to it. And they were like, here you go, gift to the internet. This fell out of my email.
And yours. And there wasn't a whole lot in the media about the strike to begin with. I just kind of found it last week. I did a little montage and put it up on TikTok. Long Island, is part of, I don't know, I guess, is it part of Manhattan? I'm not sure. I think it's the sixth.
It's part of.
They call it the sixth borough. Is what I think what they call Long Island. The sixth borough. We'll call it that.
People who are from Long Island, at least that I went to school with, thought they were their own state. Whenever in Delaware, they were like, what state are you from? There were always people who were like, Long Island. And we were like, what? So that's all I think. I'm like, they're their own people.
It seems very far away when I'm in Brooklyn. It seems very far away, very, very far away. All right. So if anybody has any information on the NYSNA agreement in Long Island with South Shore University Hospital, let us know. And again, I don't even know if this is a private or public hospital. Did not, just honest, full disclosure, did not do a whole lot of research on this one. All right, so let's skip over. We're going to go to the fake nurses. Now, there was a lot of, let me get rid of this screen. There's
some fun details about this that are coming out.
So, I can't wait. I'm on fire about this one.
And I didn't even do I did kind of not much. Let me just tell you. I did some, quick scanning of what's going on. But one of the things, so as you guys probably know, every state licenses nurses. And so every state has their own board of nursing. And then they may or may not include LVNs or LPNs in that board of nursing. And the LPNs may have a different body. Those boards typically report directly to the governor's offices and have they basically just do whatever they want. So there was some criticism coming to Texas because Texas was not being aggressive about the nurses who they had identified as fake nurses. And then they did not, they were going to kind of go through the hearing process, whereas Delaware was just get the guillotine out. And they were like, you never even existed as an RN. We have vaporized you and your license immediately. Yeah. So states are all taking this different approach. However, I think it's great, all the pressure that the public is bringing to bear and nurses are bringing to bear on this So let me see if I can.
Boy, if it was me, if I was in charge of the State Board of Nursing, I'd come out and I'd say, you've got 48 hours amnesty. After that, we are coming after you with full force of everything.
You are, Chad, you're really going to enjoy some of the energy that's coming out of what
Oh
Texas
my
has
God.
decided to do. They
Oh
saw
my
Delaware
God.
and they were like, hold my beer. Like,
So it may be a bit of a competition now, which is good. I'm sorry about the layout on this. This is a
I still stand with, I think these people should be charged with assault and battery for every single time they
there
put
we
a
go.
hand on a patient.
Mhm.
That's just me and my, I'm insane about this. This just
I am
burns my
too.
biscuits. It
Yeah.
burns my biscuits.
So and what we've asked people to do, and I really hope all nurses, everybody in the public, like no matter what, if your channel is about baking cookies, take 1 second and make a short video and advocate for people to contact their state's Board of Nursing and demand that they take swift action against any of these nurses and schools and start investigating, because it's now gone way beyond just Florida schools. There's just all kinds of stuff coming out. And it's, there's and this is all because of the pressure of the social media. I guarantee you, if this story had not hit social media, it would have just kerplunkety plunk, like, let out a lot of other stories. So the Texas board has charged 23 nurses in the fake degree scheme as other nurses speak out, right? And this was all, they say, as part of reverberations from Operation Nightingale. So it's reverberating. So these are formal charges for fraudulently obtaining educational credentials, and they have listed them
by name. And they
by
only got through the A's.
Wow. Oh my.
Yep.
Oh my word.
Mhm.
Now, and I'm going to flip over to, let me see.
And was Texas the one that also put their pictures?
Yeah. So this is interesting. Let me see if I can open this KT. I didn't open the news link. I went to the Board of Nursing. Let's see. I know there's a faster way for me to shift.
I do not want
over
a fake pilot flying my plane.
Yep. Nope. Me neither.
I don't want a fake doctor putting a knife in my belly. And if your badge says RN, you better be a real live RN.
Okay.
Yep.
Let's see if I can get this one. Okay. So this is the story. I did swear I saw something that had photos.
Someone put out I think it was Texas. I'll look for it really quick.
Okay.
They put out all the names and basically it was like a hit list. Like they were kind of like, hey, if these people come trying to get a job, no, immediately no.
Like
And I think
photos
it's
in the post office, FBI's most wanted.
Yep, exactly. That's what it felt like. I was like, damn, they
I
came
think
out
it's-
with their full energy.
It's legit, because if you can't trust somebody and they bought a fake license, and how can you trust them to even represent who they are?
Yep.
And I mean,
Yep.
that's the bottom line, everybody. And so I think it's good. I think that, I'm not against like the most wanted poster, and beware. These are people that are dangerous to patients. They're dangerous to the public, and anything they do to touch a patient is committing, and get reimbursed, or have any organization be reimbursed for that, is Medicare fraud, insurance fraud, like all kinds of things, dispensing medications, all that. So this says 2 Houston area women are trying to figure out their next move after recently learning their nursing diplomas they've been working towards are bogus. Okay, so that sentence doesn't really quite make sense. So I guess they're engaged in a school, in a program that's been cut. I don't know. 25 people, including 4 from Harris County, have been charged for their alleged part in a scheme that created a legal licensing and employment shortcut for aspiring nurses. We had classes. We did our clinicals at a clinic. Really, nothing seemed out of the normal. Well, yeah, because you don't do clinicals there are set standards. You can do some at a clinic, but typically not unless you're in a BSN. You're not going to do. We did a couple hours at like a homeless clinic in Skid Row, but as a favor, like it wasn't. We were in a hospital. Let's see. These 2 women, they started taking classes at Jean's NCLEX Review. All right, let's just take a moment for the name Jean's NCLEX Review.
Okay.
Not suspicious at all.
Breathing. I'm breathing.
Yeah. It was supposed to be a year-long course. Well, first off, a year-long NCLEX course. What? That's
You could have been through the LPN school at that rate.
And this was to become LPNs. Exactly. Yeah. So clearly the takeaway here for individuals is make sure you understand what it takes, what the state requirements are to obtain your license, whether you are going to be an electrician, whether you're going to be a certified auto mechanic, an RN, LPN, whatever you're going to do. I don't know. Yeah. So what do you guys think about this? And I'm going to show you, let me see if I can bring this one. Okay. Here's the Texas Nursing Board that lists the names.
Good. They need pictures too.
Yep. And they have pictures. I'm trying to figure out on their website where we can find the ones with I mean, I've seen on TikTok people on the Texas Board of Nursing and somewhere they have the pictures. I am all about them listing their names. I thought their names should have been released immediately.
Yeah.
To everyone. You know what I mean?
Well, they
so
probably had to go through
employers-
and figure out who all was out there.
So
Yeah.
these are the charges. And it's interesting when they're saying that there's a grounds for disciplinary action. Now, I don't really understand how this will work. And good, Lori's back with us, because they're not a
lawyer.
nurse. So how do you get disciplined if you don't have a license anymore? Help us out, Lori.
Okay, so I missed what you said, but somebody was disciplined because
These are the nurses. The Texas board is saying you're not an LP. I think it looks like they're mostly LPNs.
from Texas.
And that they, went to a fictional school.
Yeah. So it is a crime to practice nursing without a license. And because their license was not obtained properly, they did not meet the criteria to obtain a license. That is why they're being charged. You can be charged even if your license is expired. So if you have discipline in one state, I call it the domino effect. You're going to get it discipline in all the other states as well, and most likely. And so you also have an affirmative duty, depending on the state, to let other states know of discipline. So you can always be disciplined, again, even on an expired license, and in this case, on a license that was fraudulently given.
Gotcha. Thank you. And it looks like, as I'm reading this charge, this is saying this respondent was named in the U.S. Department of Health and Human Services Office of Inspector General and its law enforcement partners as part of a national scheme involving the sale and use of false and fraudulent nursing degree diplomas and transcripts. So these people were, I believe, all directly a component of that original investigation.
And I just found the ones with the pictures. So it looks like, I don't know if they've put the pictures of the actual nurses who were involved in this on here, but in a very different but similar energy. It looks like Texas just has, I sent the link in the private chat. They have on their board of nursing, they have all discipline and complaints with like imposter alerts is what they call them. I don't see the nurses that are involved in this current thing on here, but they just put your name and your face out there, like on blast.
Good.
If you've done something. So I sent you the link if you want to.
Okay. Yeah, here we go.
Pull it up.
And
Are you guys
go
ready?
for it.
Are you guys ready for this? Da, 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 da.
So, Lori, as soon as we're done here in a second, I want to go down a rabbit hole with you and just ask some questions about this.
Sure.
we can get
Most
out there.
of the names of those nurses started with an A.
Yeah,
So-
which means they're only 1/26 the way through the
exactly.
alphabet.
Yeah.
Exactly.
Yeah, there's maybe they dispersed around the country alphabetically or something. I don't know.
That's possible.
But so this, this is the first one, and this is Makisha Meeshan Thomas. I don't know if she's on that other list. There's Brittany Nicole Adams. Okay, we didn't have a photo of her, but I just want to point out. Let's see. Is it loading? Okay, let's go. Look at, she's so happy. Caitlin, you're done with. All right. So Caitlin here gained employment with a home health agency in Sherman, Texas, using their RN number belonging to another licensee. Here's another issue that happens. People steal the license numbers of other nurses who have a similar or same name. Another reason I'm very happy for my name that is actually very unique. Or people who have died, who have not been removed from the Board of Nursing list, which is another kind of cleanup oversight on these boards of nursing. She provided direct patient care while representing herself as an RN. She was like, I don't want to fake being an LPN. I want to go right for RN here. So she's going to be criminally prosecuted, this person here. Any comment?
Yeah, there
So-
was a nurse who, it's in Indiana. In order to get in the online system, you just need a license number, which is public record, and the last four of a social security number. I don't feel that that's very secure. And yeah, so this one woman, she actually got a job as a director of nursing.
Oh my
God.
Imposing as somebody else. Unbelievable. And she has criminal charges. I don't know what the status is now, but they'll try anything. It's really crazy.
And that's terrible on the part of these boards of nursing. And is it true, Lori? And I don't know if you know this. So I had heard that there are 10 or 13 states where it's actually not illegal to impersonate a nurse.
Whoa.
I don't know about that. That's
It's actually not illegal in every state. I'm going to do a little investigation. Here's one for you. Sorry, we don't have his picture of Dan Prasad. He's a midwife from British Columbia College of Nurses.
Okay. So, Lori, this is where I need your input.
okay.
I didn't go to nursing school. I fraudulently obtained a license. I got caught. What can I be charged with? Can I, obviously impersonating a nurse, can I be charged criminally? Because in my opinion, especially like in what I do, labor and delivery, every single time you touch a patient, that's assault and battery. And especially what I do, every time I stick my hands certain places, that's a different kind of assault in my mind. Can they be charged like that? Or is that, I'm asking Lori here.
Well, I don't do criminal law, but I assume they could be charged with different counts of battery, for different times, different parts. I don't know. But unfortunately, I've had a couple of calls from nurses about this, and, they've been practicing and doing well for so many years. They're like, well, why can't I keep my license? And I'm like, because the license wasn't properly obtained. And other people actually went to the school. They paid their $15,000. They went to the school. They did all the classes. They passed all the tests. And they're like, well, again, why can't I, continue to practice? And it's because, you should know, if you're going to go to a school and you want to get a license, you have to make sure the school is approved. And in California, nurses who went to Excelsior College in New York cannot get a California license because they don't feel there's enough clinical hours. And even if they've been, I have one that has a master's degree, and she's like, are you kidding me? I've been doing so well in so many other states. Why can't I work here? Again, they don't pass the minimum criteria.
Yep. Which is a huge thing to have to just know, to go back. And when you're looking at nursing schools, make sure to see who are they accredited by. Lots and lots of places will accredit nursing schools, but you want to make sure it's preferably one of the big two. There's AACNE or CNN. There's two of them. Just Google them. They're like the biggest two. Because if they're accredited, your state will accredit with all sorts of other little accreditation places. And I saw so many exactly like that. Lori was like, in Michigan, they had a whole bunch of schools that had Bachelor of Arts in nursing degrees at these private little colleges, and then they could go nowhere.
No such thing.
Yeah, they would go nowhere because
thing.
Michigan acknowledged it, where they went, like the state where they lived acknowledged it, and then they would try to move out of state, like to Chicago or something. And Illinois was like, absolutely not. Like, no. And you can't go to grad school. Like, it becomes a whole mess. Tamara said in the comments, I just found a story in Colorado about a woman who several years ago managed to work her way up to a assistant to, I think, ADON. What is that?
Assistant Director of Nursing.
Director of Nursing.
Yeah.
A mess. That's a hot mess. And then Alicia said, with these charges, will it prevent them from obtaining a real license in the future? That's a good question.
Yeah, you're guilty of fraud in the first place. They're not going to give you a license in the second place.
Yeah.
And
That's
just
ethics
blown off.
is the core of nursing. People, you go into people's rooms when they're the most vulnerable, or their houses, and you have access to, anything in the house, and they want you to be honest and ethical. And
Mhm.
the easiest way is each state's Board of Nursing is responsible for nursing education in the state. And so, I would check out through the Board of Nursing to make sure the school is approved, and that they have a good pass rate, because some of these schools are on probation because they don't have a good enough pass rate for their students. And if it's too good to be true, and no other school will accept you, and then some other
Yep.
school does, you got to wonder about that.
Mhm.
Yep, absolutely.
Yep. And
Yeah.
ask about schools' attrition rates. How many people who start do not pass, don't get to actually graduate, right? Because some schools they'll be like, oh, our NCLEX pass rate is 99%. When you come to find out 150 people go into a cohort and 30 leave because the school's just terrible, and they just weed, they're just well, only those 30 people or whatever survived. And yeah, they're going to look up when you apply for your nursing license, they run all sorts of background checks on you. So they're going to know all of the things you did. So this would come up that, oh, wow, why do you have impersonating a healthcare provider on your record? Immediately
Right.
no. The school might let you go to nursing school. The Board of Nursing will not let you get a license.
That's
They'll be
right.
no, thank you.
Anyway, Lori, I'm just wondering
And
what the scope of charges could be for some of these people.
Yeah.
I mean, some of them just honestly didn't know. They had no idea. And so,
I have a hard time swallowing that one. I'm sorry. I'm with Liz. You know what you're buying when you write the check.
yeah, I mean, one said they actually went to the school and completed the classes and did the test. So, and they only had 1 quarter left. So I don't know. And, maybe I give people the benefit of the doubt. I know many of them probably didn't,
Mhm.
knew what they were getting into and thought taking the easy way, which is never the right
Never
way.
the right way. Never the right way.
Well, this is another opportunity too for the public and nurses to unite and get a hold of your state laws and find out what are the laws in your state, and start writing some emails, making some phone calls, getting a group of people to go see your state representative and saying, hey, I would like you to sponsor a bill that makes it a felony to impersonate anybody who requires a license in healthcare, period. Just respiratory therapist, everybody, LPN, nurse practitioner, whoever has to have some kind of specialized training, and that is falsified, because there's no reason not to do that. For one, we need to have a very clear and delineated system of punishment for people that are doing this. And it's not enough to have it be a misdemeanor, because in the states where it is illegal, it is mostly a misdemeanor charge. Even in California, I think it's a misdemeanor.
Anything you
So,
have to have a license or certification for needs to be
right. Yeah.
Yeah.
And that argument of, well, I've been doing it, so can't I just continue doing it? Well, no, it's just a hard no. And I don't know what we have to do to explain that, but it's not when you have initiated something, and I'm not using the right language, Lily, but when you've initiated a process under fraudulent, cause, with intent, you cannot be trusted. The trust is broken. That's the issue.
Yeah. And I think some of them, Lori, you can correct me if I'm wrong, some of them aren't even always fraudulent. Like with some of the cases of if you went to a school that just wasn't very good, you went to nursing school and you did all the things and you took the tests. There needs to be better regulation amongst nursing schools about who's allowed to call themselves a nursing school, so that you can't get these poor people who do a 4-year degree pass and then they're like, oh, well, I have my bachelor's of arts in nursing. Like, what do you mean that's not a thing? And then all of a sudden you're like, oh, well, that's not real. You know what I mean?
Yeah.
They're just, nursing education is so unregulated that it's insanity.
Yeah. And I think it's only this situation, Aspen University here, or a lot of these colleges, the only reason that any regulators have come in is because of student loans. It's been mostly the student loan issue that then has triggered the investigation, or the Board of Nursing, of course, is involved. But, they're just, those seem to be the two integers in that process, when in fact it really should be much more broad. There should be much more checks and balances. Like in this situation of Aspen University, they already lost their license. to have a nursing school, but they were allowed to, I don't know what the word is, continue with the people in the program to finish. And now they may get pulled for that because they still are not following the guidelines set forth in Arizona by the Board of Nursing there. So they surrendered their nursing program license in 2022. And now the Arizona Board of Nursing is discussing further action. I'm not sure what else they're going to do, but let's see. So going back to 2021, the Board of Nursing began its investigation, several complaints. The school's first-time pass rate fell below the 80% standard. So again, Arizona has some 80% standard for pass rates. Again, I don't know what they are for all states, if all states even have that in the Board of Nursing. So this is Aspen McKenna, I guess it is. Is that the name? I'm not sure. Or no, McKenna is one of the 400 students in Arizona's program. I mean, this is a massive nursing school, 400 students.
And that sucks. Can you imagine going and paying all that money and going to nursing school and then being a senior and then all of a sudden they're like, oh, never mind. None of that counted.
I can't imagine.
And that's another place.
Cry.
Yeah, I mean, and all the money, and maybe you took out loans. I mean, just everything. Maybe you quit your great job you had. I mean, like I had to go to nursing school. I think this is another area where there needs to be some regulations that are hard and fast that allow these students to transition over into other schools, like a fast track kind of transition. They should not just be left to languish. They have put money in, they've put the work in, they have good intent, and they've done all the right things they needed to do. We should not leave people, and especially when, everybody's yammering at the top about the nursing shortage, right? Well, let's help these people get through a nursing program, but it is extremely hard to transfer into a program because there's no space. And the cost. So yeah. So it's called a teach out. So the school was put into a teach out process where they were allowed to let the rest of the students finish and complete before the school closes. But the board can terminate the program if it determines it's failing to meet basic standards of education. Yeah, I mean, this is horrible. So again, just another example, if you are a prospective nursing student or any vocational college of any kind, do your research. Just try to not go to a new school. I don't want to bash new schools, but just do your best to go to an established public university if you can.
Yep. And ask around. You can ask around on Reddit or on different Facebook groups. I mean, people are happy to tell you and complain about their schools that they go to. So just ask, hey, have you gone here? Did you feel like it was impending doom? Because I'm vetting the vibe of these places before they close, is having talked to some of the students who have gone to some schools that have closed recently. It's impending doom. They're like, yeah, this is mad chaos. Don't come here. So just ask. All right. I have to hop out, but Adrienne, thanks for letting me join and chat.
Oh, thank you, Liz. Thank you. And thank you for the tutorial. Liz spent a lot of time with me to show me how to do all this magic that she does seamlessly, which we still don't have a chat, but I don't know. You guys can see the chat though, right?
Yeah. And it's over on YouTube. So people can chat. Like Matt's here, Tamara's here, Alicia's here, KJ was here. So if you just open a new window and have YouTube on the side, you'll be able to see it.
And then sorry, you guys, I can't highlight your comments. I apologize. I just threw this lovely woman in for good measure. This is see you, Liz, have a good afternoon. Not a lot on this story. This just happened a couple days ago. A director of a Bradley University director of nursing and department chair arrested for 10 counts of theft. Just wanted to throw that in for good measure. Because the mugshot was too good. They don't go into details. She doesn't
theft of what? Happy. Theft of pencils or
Well, this is the weird thing. So 10 counts valued at less than 500. My brain just can't figure out what that could be. What do you steal 10 of? What do you steal 10 of that's under $500 that actually gets you arrested?
Right. I don't know.
Guys, there's so many things I have in my mind. I think if it had been like drugs or something they would have said, but maybe, and I don't know if it was, yeah, she was hired as the chair of Department of Nursing at Bradley University. She's listed on Bradley's website. She has a whole bio, 35 years of experience in higher education. Yeah, there's no comment. So we're going to, I just thought I'd throw that in for good measure to make everybody, kind of get your brains thinking. And let's do a little bet on what did she steal. Let's play the what did she steal game. And we'll hopefully find out next week. I'm going to follow this story because, I couldn't find any other information on this. So, so let's see, what are we going to go to now? Okay, this is a really important one. I did get a lot of my information from Becker's Hospital Review. So this is an issue that has gotten quite a bit of traction on social media about how organ transplants criteria, these calculations often exclude Black patients from being on organ donation lists. And so that, because based on, and now I'm forgetting, is it the creatinine test? Can't remember, it's creatinine clearance.
Creatinine's one of them.
It's one of those, right? The crit test,
Yeah.
creatinine. Now, Black Americans have a higher likelihood of being diagnosed with kidney failure than white Americans on a widely used test for decades, prevented individuals from getting needed transplants sooner. So that is all being thrown out. The Organ Procurement and Transplantation Network Board, which I've never heard of, but that's apparently who's in charge of transplants, or they set the standards, has unanimously approved a wait time adjustment aimed to correct the inequity. So I believe that means that those people who are currently on a wait list, they're using some kind of criteria to move them up the wait list, change the orientation. And also, just so you guys know, these wait lists change by state. I've known several people who've moved to other states out of California that needed kidneys that got them in other states. FYI. It's not, I had no idea about any of this because I don't really know much about transplants. I didn't realize it was like a state by state thing. So you guys know anything about this? What do you guys think about this?
If I remember correctly, your GFR, your glomerular filtration rate, is a measure of how much your kidney can clear at any given hour, and it's that calculation is different in Black people than it is in white people. And I don't remember all the criteria here, but I don't think somebody was adjusting for that difference.
Right.
And which was making it so that Black people, oh, you're fine. Well, they're not fine. They're not fine. Their GFR is calculated differently, which means they're not fine. And so they were getting shoved further down the list, if I recall. I could be wrong.
Yeah, so I think there's been a lot of talk about adjusting these numbers for Black people, and there's again a lot of disparity in healthcare based on that standards are set. By and large, you guys, for the people watching, standards for even whether it's medications, tests, like we know a lot about now, pulse oximeters, and how those misread for people with dark skin. Are based on light-skinned, often male people, humans among us.
Well, all human studies for decades and centuries have been based on white male, age 25, and that doesn't fit everybody. Even the heart attack criteria, women don't get chest pain; they tend to get pain between their shoulder blades, or complain of indigestion, or anything else. And so we can't build everything off the white male.
Exactly. So that's good news that that's going to be changing. We'll be following that story as well. And I wanted to come back to another story, our story about let me close that window. Another thing going on, this was actually announced back in December, was the Joint Commission is going to launch a health equity certification in July. I don't know exactly what the criteria will be. Many of us are often cynical about these certifications because there's so much going on. There's so much disparity in healthcare and so much going on. I don't know. What do you guys think about this with the Joint Commission? They're launching it in July. So as of July 2023, hospitals will be able to clamor to the Joint Commission, send them some kind of giant form and criteria and a check, and be able to stamp something on their PR and on their websites. What do we think?
What's the health equity certification about? Can you? I didn't have a chance to read up on it. What does it all entail?
Let me go. Whoops, here we go. I think this.
Give me 3 or 4 of the bullet points.
Yeah, let's see. Okay, hold on. We're going to go to the Joint Commission site. Okay, they have not much. Request the health equity standards. Let's see if this opens it up.
There you go.
There we go. Okay, it's a voluntary program. Who is eligible? Strive. It doesn't really have a whole lot. It says initially hospitals and critical access hospitals that wish to strive for excellence in their efforts to provide equitable care, treatment, and services will be eligible. I looked actually for information and I just found this. And this is on the Joint Commission. So okay. So you got to fill this out. I'll fill it out. We'll come back later on another episode and go a little deeper, but I'll be curious to know. But you can go to the Joint Commission website, request the pre-publication standards, and also join the Joint Commission mailing list. But I'm putting this in the category of things I'm cynical about. That's all.
Yeah.
Yeah. Well, again, does the public really know if a hospital is Joint Commission certified or not, or accredited?
Well, they put it up on the
Yeah.
hospital's website, and it's supposed to, like the magnet status was 20 years ago, that it's supposed to mean we're the be all end all of hospitals and so forth.
I found that story after I had found this story, and I thought, wow, there's definitely going to be a lot of work to do, right? So so this will be interesting. So one other thing that as the story came out, and this is based on a little bit of dated research, because big research studies take a while, and they're usually a few years old. But it turns out, surprisingly, members of the LGBTQ community continue to have worse health than peers, the study finds. Now, this was a study that was set to update a 2013 study. And I believe this study started in 2018. And so a lot has changed. And they framed this, let's see, they're very clear in framing this, right? That there's 321 bills right now at the time of the publishing of this that across
hey,
the country.
Adrian. Adrian, Nurse Scott's here.
Oh, Scott. Oh, good. You know what? My screen.
Let me in, or I'll huff and puff, and he's getting upset.
I'm so sorry. Good. You know what? Because he's below.
Hi, Scott.
My screen. Hey, Scott. How are you?
Hey, everybody.
Hey,
Hey, bud.
How are you?
Just
Done
sorry
with my
to
other
keep you
meeting. I
waiting.
thought I would join you in just in time. It looks like.
Good, because
Yay.
Liz just left 2 minutes ago. So
We're running through the news. We're running through current events,
Yeah.
and then we'll have a little time to chat afterwards. So, have you seen this study? This just came out.
Not. Yeah.
Okay.
Not surprising, but no, I haven't seen it.
So
And
what is the crux of the study? Is it because they're not seeking care? The providers aren't giving the good care? Why are they not?
Yeah.
in
Did they
this
say
business?
why?
So this is a Becker's hospital review summary. So they don't go into big detail. They reference other. Let me see if I can find the link here. Okay, here. Let me find this press release. This is from Harvard. Okay, let me get this pulled up here. The findings. And I did pull up the old research from 2013. And I think that, let's see, okay. So I don't see like hard and factual numbers. I know that they're here on this research somewhere because this is a published paper. So this is from Harvard, and inequities driven by, the font they use is really tough. Lesbian and gay bisexual people are at a greater risk of dying by suicide, which I don't know if I can say that. Great. Cardiovascular disease, some cancers, and have a cascading list of other health problems. Existing research shows that LGBT people are dying earlier and getting sicker than their non-LGBT neighbors, family, and friends because of structural barriers to healthcare stigma and the damage caused by stress associated belonging to marginalized groups. Now, this has been a big topic about If you're in, a minority group, marginalized group, by nature of that fact and the stress you live through in your life, is that real? Is that a real impact on your health? I tend to say it is. It's something that doesn't have I don't think it has a diagnostic code. And let me just see here.
Yeah, I think it's actually smart that they've done LGB, because the trans community has been studied separately, and we all get lumped together for certain things, and that makes sense. But I think for this, it's interesting to look at people that are just lesbian, gay, bisexual, and what's going on with their health.
And because it is, that's a whole topic. That's a whole topic for sure. So I want to just give it some numbers. So the National Health Interview study included 171,000 people who were classified as heterosexual, 3,000 as lesbian or gay, and 1,744 as bisexual. So again, this is a sampling of 183,000 adult participants. And this was a CDC study that went from 2013 to 2018, if I'm reading this right. And what it shows is that these gaps in healthcare status and access, which is, outside of the individual, did not improve through 2013 to 2018. People continued in the LGBT community, adults, this is adults also, report higher levels of poor or fair health status, functional limitations, severe psychological distress, and difficulties with healthcare affordability than their heterosexual counterparts. And they go into how to improve these factors. So it's just interesting to note. I'm presenting actually at a symposium next month on patient safety for the LGBTQ community and what those barriers to access are, and how patient advocates specifically can help improve to take those barriers down and improve access to care. This is the study, which I'm going to just share really quickly. That's the study. And that is a research letter that was published just February 20th, 2023. And that's on JAMA Network if anybody wants that. Thoughts? You guys?
So I live in an area of the country where there's not a whole lot of LGBTQ people. And it's very obvious to me why. There's a big stigma about it, and they're just not accepted in this particular area that I'm in. And I think that's really sad. I think that can cause a lot of stress in somebody. They got to continually, every day of their life, hide who they are and what they're about. They can't hold hands with their loved one out in public because they're going to be ridiculed or even beaten up. And not to blow my own horn, but some time ago I had a lesbian couple come in to see me, and it was obvious to me that they were very skittish. They were very they didn't know what to do with this new provider. And when I walk in the room, I'm like, oh, I'm so-and-so. You're obviously a patient. Who are you? And, sometimes it's their brother, their husband, their dad. I don't know. I was expecting a friend or whatever. Oh, this is my wife. Oh, all right. Well, so the three of us talked and we got through the exam. We made our decisions and went on. And as we got through this visit, the wife says to me, I need to be examined too at some point. Would you mind seeing me? Not even a problem. At the end of our visit, she felt comfortable enough with me that she wanted to step up and say that, she needed help too. So I had a lesbian couple that I saw. Didn't bother me. Don't care. But I know for a fact, had they seen anybody else in my office, it would have been a problem.
I've trained him well. Don't you think I've trained him well? I don't take credit for that. I think you should blow your own horn. I think that as a straight white male provider, that it helps so much to have people in your position, which is a privileged position, have an open mind and be accepting. And all you had to do was just treat them like normal people. You didn't have to say, I am so LGBTQ friendly. I'm so glad you're here. You know, you just had to treat them like normal people, and they picked up on that, and that's what made the difference.
That's all I did.
Yeah, and that's all anyone has to do. Why is it so hard?
I gave them the best care that I could, which is the same care I give everybody. That's all I did. So, but as I said, in this area of the country where I'm at, anybody else in my office would have been like, so.
Yeah, they would have picked up on that.
Yeah.
And there's a lot of laws going around right now across the country. And then we also have, the Affordable Care Act, which language that does offer protection for LGBTQ populations, for people, but that might also get gutted by the Supreme Court. So that remains to be seen. There's a lot at play right now.
On the other hand, I can legislate till I'm blue in the face. I can't make you feel it. I can't I can't teach you compassion. I can't teach you.
Well, that's the work we've been doing for decades. That's the changing of hearts and minds. The changing of hearts and minds is the work. It's a social movement. You don't legislate that. And that's when Harvey Milk said, come out wherever you are, be visible, because when you're invisible, people make up their own ideas about what gay people are. They're pedophiles, they're this, that, the other. And when they meet you, they're like, oh, you're kind of a normal person. It's like, yeah, we are. How about that? And the more people you actually are out of the closet that you know, then you can base your opinion on that group based on actual human beings. And that is what changes hearts and minds, and go, I know gay people. They're not that different. I know Mormons. I know Jews. I know, any number of groups. And it's like, they're not that well, they're a little different because they have a different religion, and they have, whatever. But, you're able to humanize that. And that, of course, you can't teach. And of course, you can't legislate it either.
No.
Yeah, I think it's interesting, because I think there's one thing to say, okay, we're going to treat everybody the same. And I don't agree with that, because I think that, again, is the sameness of what? The sameness against what standard, right? Because there are unique needs that people are facing, and in different situations, whether they are a refugee, whether they are from a different country, whether they, speak a different language, have different practices of, how they take care of their bodies, right? And the most important thing, and as I feel very strongly about this as a nurse, is that it is up to us to really handle our biases and identify the things we know about ourselves, and even explore the things we don't know about ourselves, to really discover our biases, because we all have them. But there's really no place for that. It's up to us to address those if we are going to be in a place of providing care for people, because there is no way to say, I'm only going to provide care to this group of individuals, right? And there's just no place for that in healthcare. And of course, we've all seen, discrimination of some kind in a healthcare setting. And I don't know, I'm kind of curious, Lori, if you're aware of any boards of nursing or any kind of charges on these issues that have ever come up specifically from the boards of nursing.
I have not seen charges, but I did see a complaint when somebody was not addressed by the proper pronoun. It was not a nurse. And that person was really upset and filed a complaint. So other than that, I really haven't seen much. But also, I'm licensed in Indiana and Illinois, and it's not, I've represented a number of same-sex relationship people, but again, whether it factors into the board or not, I haven't seen any of that, except on this one occasion.
I would imagine that it could be, plausible that there could be complaints written against a provider or a nurse or even a hospital for dignity and respect under that requirement, under CMS, under certain state, depending on the state laws. I just, full disclosure, my experience as a lesbian, I came out when I was 13. The amount of times I've been asked if I'm pregnant when I would go to an ER, an urgent care, a doctor, and then have these conversations that were incredibly uncomfortable. The thing to think about is that when people go into a doctor's office or a provider's office, if you're heterosexual, you don't have to think about, I'm going to bring my spouse, my girlfriend, my boyfriend, you know, whoever they are. Right. And again, this, and yeah, you may, if you're maybe in a certain area and you're in an interracial relationship, maybe you do, or a different time, but those kind of factors. So if I feel like, oh my God, I have to go alone because I feel like my provider's homophobic or they're biased or they're prejudiced, so I'm not going to bring my spouse or my girlfriend, my boyfriend. Well, that is a patient safety issue, because now you're not going to have that second person who remembers what the provider said or can have that open conversation. You're already tense. You're not really feeling like you want to share. This person's interviewing you, asking a lot of questions, and I've been asked some really inappropriate things actually, by providers and in my life. Because again, I'm 55. I came out when I was 13. So I've had over 40 years of seeing providers, and, because I was an athlete, I, had injuries in high school through college, just the normal stuff. So it's very important that we flush out there's a lot of other things. You can go be an auto mechanic. You can go sell bonds. You can do a lot of things and take that prejudice somewhere else. It does not belong anywhere in healthcare. It just doesn't. It's really poisonous. That's how I feel about it. So I'm not surprised about the study. And I think it's so different. It really honestly just depends on where you are in the country. And even then,
Absolutely.
it varies so much. And that's the sad part, is that many people don't go live in certain areas because, like you're saying, Mr. Midwife, that, it's not a welcoming environment.
Right.
And even when we think it is, I grew up in LA, and, I often encountered, a therapist who, thought I should, well, why don't you try dating a guy or do this, or, completely unethical, like a real breach of ethics, that happens. And these things don't get reported because people just don't know where to go, so I think it's a real access issue here. Plus also, I'm betting if I went deeper in this research, there's going to be information about insurance, spousal insurance and coverage, and that kind of level of access to actually health insurance. So yeah, I wanted to bring that up just to raise awareness on that issue. There's a lot going on, lot of areas we can do to improve, and just encourage your healthcare provider, to be cool, be nice, be kind, be kind.
Be a person.
Be a human being. I mean, look, we all have our own bias. None of us is perfect, so it's okay. And I think that there's a shame about it that has people not talk about it, and a shame and a fear of calling people out on it. I worked in a heavily Latino population area. And often three or out of the four of my patients spoke only Spanish. A lot of elderly people. There were times when I would pass off my patient, and I would say, oh, this woman's like 94 years old, but she doesn't speak any English. The granddaughter, somebody's going to be in tonight. Just stay with her. Families are really good that way in Latino culture. And I would have the nurse would say to me, I don't care. I'm only going to speak English. That's not my problem if that person doesn't speak English. A real adversarial. I can tell you, I heard that a lot. Yeah. And these were people I had known before I was a nurse. And it was like ick. It was like, oh, I liked you. I thought, like, we've hung out and you're saying this, like,
yeah.
And it's like, this is a human being. This is just a little old lady. Like, take your political agenda, do something else with it.
Was that some compassion fatigue? Was it someone just like, God, I don't want to have to go, try to figure out how to communicate with this person. I'm so, I've just been doing this. No, it was just kind of narrow-mindedness.
No, it was just prejudiced. Prejudiced and really being attached to an ideology. Yeah, I mean, this was somebody who just, cruised through their shift, worked part-time, and I just, And I think we've all seen that on some level, you know, and so there are people we may think in our mind, oh, I can't have that conversation. But I think it's okay to say, if you're a healthcare worker, that what I witnessed or how you talked about that person or how I witnessed you approach that person or the patient made me feel uncomfortable. And I'd like to know that you give the best care to everybody. You know, there's a way to say it that isn't like, hey, you're a bigot, you know, but there's a way to say, hey, this made me uncomfortable. And it's really important that we as a team are perceived as giving the best care possible. I don't know. What do you guys think? Is there a way to do it? Is there a way to say it?
Chad and I were just talking yesterday on the phone, and we were talking about one of the million things we were talking about yesterday was the different ways that men, and we had a long conversation, men and women work and communicate. And what you just demonstrated for me, anyway, is a very female way of approaching things. You know, I want the team to work well together. I'm concerned about it. Whereas a man would go, you're being a dick. Did you know that? You know, they would just be very, maybe not in those strong terms, but would just say, you know, really, you know, that's a little racist on your part. You know, I mean, we're supposed to be taking care, you know, just kind of be a little more confrontational without being offensive about it.
Oh, I would say that. That's how I would say it too.
I was just going to say, it may not be a strictly male and female thing. There are men that will communicate in that kind of softer way, and there are people like I would expect you do that are pretty straightforward in how they approach things. But just to shine a light on the fact that there are different ways of communicating, and that when you get people in the workplace together that communicate in different ways, it can be problematic. But the point being, the point you're trying to make, though, is about treating people with respect and respecting their differences. And they're not asking you to go above and beyond your job to try to accommodate their communication needs. That is your job.
Mm-hmm. Yeah.
It is your job.
Thoughts you guys on this? How you would approach maybe a colleague?
Mm-hmm.
Well, I've had these types of situations before. And you know that classically, at least in labor delivery, Black women, they're not believed about their pain. You know, they ask for an epidural. Oh, you can't be heard of that. And I'll just acknowledge it. Yeah, because Black women don't feel pain, huh? Gets them every time. You just acknowledge what they're saying. Yeah, because Black women, they don't feel pain, huh? Get her an epidural. You know,
right?
It's hard. Yeah. It's hard. I
think it's hard. I mean, it depends. You know, if somebody, for me, it's like I've had to learn how to communicate. We've talked about this before. How until I was became a nurse, I really, you know, I was really. You think I'm direct now? So diplomacy. Adrian has to work constantly on diplomacy because my communication scale wants to drift in one direction, and I'm always trying to bring it back over to another direction. So to me, it's putting it in a way where it's not just using like transformational communication to not have that person get defensive, and then because I don't really want to hear about their political ideology in the context of them being a healthcare, you know, any of us being a nurse, being a provider. You know, I was at the end of my time in the hospital, I was heavily harassed and discriminated against by a non-white physician, a female physician. It was young millennial physician. I was very shocked, and it got very escalated. And, you know, we're to the point where she would just hang up the phone on me and refuse to be in the same room with me, even when I was charge nurse. And I actually got injured and I left in workers' comp because had I not, I would have actually taken it further because it was really affecting and impacting. It was impacting patients, and it was just obvious to everybody. Like, you know, like there was times where, you know, I had to get my manager to come out because a patient was acting a little, you know, wild. And he said, call the doctor. And I go, she's going to hang up on me. I've already tried. She's hanging up. And I literally put my phone on speakerphone and I called her, and she hung up 3 times while my manager was like covering this guy with his body to restrain a patient who was kind of going, you know, a little ape shit in the room. so that we could get medication. And he just looked at me and I was like, well, sorry, you don't have a hand free, so you can't call her. We're going to have to get the house supervisor. And he got the vice president of nursing involved. But that's where, when we have biases, whether it's with each other, our colleagues, patients, it creates a friction in the healthcare environment, and the patients are the ones that are going to lose. The patients will lose. So, in that case, I actually documented that in the patient's chart, because that's something I could be held liable to. How will I protect myself? And Lori, you might have something to add in this. I was really often in a conundrum of, how am I going to protect myself? Because this doctor will not communicate with me she will not round with me as required in the rooms. And then when I was charged, she wouldn't round with me as a charge, And so how would I explain that in my charting of why a patient didn't get a medication, why an intervention didn't happen? I mean, what do you think?
I think you have to go up the chain of command and document, because otherwise you're not being a patient advocate, and the patients aren't getting what they need, and he's not following policy. And unfortunately, when nurses self-advocate like that, even in a positive way, the hospitals are so protect thy physician, and he could be retaliatory, all kinds of stuff can happen. And most people will be like, well, let me just keep my mouth shut. But that you shouldn't do that. If I always say you can get another job, you can't get another license. So go to some place that treats you well, and you don't have these issues.
Yeah. I mean, I documented in the patient's chart, attempted to reach physician refused to answer phone. Because if something came up later, me doing a report up the chain of command I wouldn't have access to that. I wouldn't be able to prove that. I would forget, because, these charges might come 5 years later. And I notified the hospital of that. I said, go ahead, look at this chart. I did the incident reports on the doctor, and I noted on these charts, I have documented this in the patient's charts, because I have no other way to protect myself in the patient record and have any, and that's the thing that nurses are often up against, sadly, for whatever reason.
Right. But when you said that he refused to answer, do you know that for sure?
No, I mean, I said that instead of hanging up. I mean, this doctor would hang up on me, right?
Oh, okay.
They would actually hang up. They would actually answer the phone. It was me, and then hang up.
I would say call disconnected, but you want to be.
Yeah. I mean, I think I may have wrote something like that, but I mean, to be tactful and appropriate, but then also have I have tried and then escalated up the chain of command, and I would put that in the patient's note, utilize the chain of command, MD, it's difficult. It's very difficult for nurses to protect themselves in charts when there are, harassment issues going on, or when there's just ineffectual providers that aren't, giving us orders. And it's, because you're told, don't put this in the chart, don't put that in the chart. So that's just another issue. But yeah.
Yeah. And it turns into a he said, she said, and those never go well.
Yeah. Yeah. I mean, in this case, there was lots of witnesses that had seen it, and it was getting a little bit escalated, and very uncomfortable for people. But yeah. So anyways, let's move on. So I want to come back. I forgot about this one on the fake nurses, because let's just keep getting all of us riled up on this one. Let me see if I'm going to get that. Okay. So New York, again, this is off Becker's Hospital Review, and I do have the link for the Board of Nursing. To 900 nurses, prove you have credentials or surrender your license. So Here we have a different take on it. So investigation to fraudulent nursing degree scheme continues. New York officials are requesting more than 900 nurses in the state prove their credentials are legitimate. So this is kind of a different take. They're not going to disprove, I guess. I'm not sure. So this is 903 nurses from 7 nursing schools. They have 14 days.
That doesn't sound like long to get your transcripts together and everything else.
Right. Well, that's the other part, right? Is
I don't mind that they're doing it under the circumstances. You've got fake nurses out there, but 14 days, it's going to take a little time. It takes that long to get
And these were all Florida nursing schools. These 7 schools were all Florida nursing schools. They required them in 14 days. They, again, they go into the story, the $10,000 to $15,000 for fake degrees. 37% passed the test. Now, they have also paused the license applications. I didn't hear about this before, for 2,352 nursing students with credentials from these schools until they can prove they've met all the necessary requirements. So apparently there were still some, students in the pipeline. This is I'm going to show you the website from the Florida. So this says update, Florida schools investigation. I like that they've just put this on the Department of Education Office of Preventions. This is for New York. So this tells you by college who has pending applications. And so this is the breakdown of the 7 schools. So because I'm looking and I'm like, how are they getting to 2,000? There's 92, 43, 177, because Palm Beach School of Nursing at the bottom is 1,644. And of those, and there's additionally 571 that are licensed. So if you add those columns up on the left, that's about 900. So let me see, they have contract. Oh, this is interesting. Since the education submitted is not acceptable, the department requested the individual to return the license parchment. Interesting, the actual paper. Have a qualified nursing program submit verification. And these nurses will be contacted. Sorry, let me blow this up a little bit. Certain aspects of the criminal investigation are confidential. And then the other applications that are pending are going to be held until they can show that they've met the requirements. So it doesn't say what they're going to do if they don't turn in their parchment, the actual physical. I guess you get, some states like California don't even give you a license anymore. You used to get a card.
Actually, they used to give you a 8.5 by 11 certificate, but you only get one once. And but you don't get cards anymore. You don't get a card to carry around because they all verify online. And because when I got my public health nurse certificate, I actually got another one that looked like that. I don't know where it is. And to replace them is like $60 because it's California for a piece of paper. Maybe you don't need it. It's just if you want to frame it or something like that. But that's
I like
odd
the card, though.
It's not worth anything. It's not worth anything to have. You can't walk into a job and show them that certificate and then go, oh, okay, we'll hire you. They're still going to, do the verification.
So what I'm guessing on that is that they have probably done something to suspend their license in the electronic nursing system, yet these individuals still have the paper that they could, I guess somebody would accept that. I don't know.
I don't think they're going to raid their house to get those documents out of there. It's just
maybe the FBI. Yeah, I mean, these things can be also.
Raid. We have a warrant.
I'm just curious again. I only brought this up because, again, I just think we have to really stay on top of this issue and keep the pressure on these boards of nursing and on the federal government to continue this investigation and keep pursuing these colleges. I just think that this is way bigger. We all know it's way more, than the Florida schools. It's, all over the country.
All the states, right? Because those nurses go from there out into the country. I emailed the contact that I have at the California board to ask, what they were doing here in California. And I haven't heard back, but I understand it's an evolving issue and it's probably sensitive. I'm not sure if she necessarily wants to just send me an email and tell me what's going on in the middle of the inner workings of the board, because, who am I? And with a social media presence, I'm almost media. So, she may not want to talk to the media or media adjacent folks about this, at least not this early in the game. But I'm sure it affects California as well.
Yeah, and if a nurse has multiple licenses, maybe they went to one of those schools and then had their license endorsed in other states, it's all going to catch up. And if you surrender your license in one state, the other states are going to be on you.
Will they? Do they communicate amongst themselves?
No, but they they have nurses, and you have an affirmative duty. But again, if they find out, it's fraud and continuing practice.
Yeah, this is why we really do need everybody to get in touch with their board of nursing in your state. So if you're in whatever state you're in or territory, contact your board of nursing and your state legislators and really put the pressure on, and your attorney general. Say, because this is a public, it's a public issue. This is a health issue, right?
Yeah,
I
but
mean,
these nurses want to work as long as they can, so they'll go to another state or whatever until they're caught, because then it's game over.
Right, exactly.
I
think
hope
that
these people are wearing orange by the end of the year.
Yeah, trade their whites into orange.
Yep.
Yeah, I think that, again, I think this is going to take a while. This investigation has been going on for years. I think I shared with you guys that some of the schools here in Virginia were also owned by a couple of those people in Florida, and those schools were closed. One probably just very close to my house. We're going to switch to some good news, some positive news about West Virginia. There's a nursing program with an accelerated BSN program, and they got a perfect pass rate on this is accreditation exam. But this down here says their national licensure exam. So I'm not sure if the headline matches what actually happened. Does that make sense?
Well, congratulations, West Virginia.
West Virginia University, accelerated nursing program, 100% pass rate, 23 students. We are very happy that you did a good job. And it's an 18-month program for students who already have a bachelor's degree. And composed of older students. Yay for older, whatever that might be, because
Careful.
My doctor, because I was in the ER for a hole in my eye, and my doctor had to bring up the 60. He had to say the 60 word as you approach 60, and I was like,
"Hey, you want to know what was even a bigger insult was? I applied for disability when my back gave out like 6 years ago, and I was 49. And of course, it goes on for several months, and then a year, and then finally goes before a judge. And what they decided was that from the time until I turned 50, I did not qualify. But after 50, I fell into the category of approaching older age, and I did qualify from age 50 on.
Wow.
So the first few months I was applying for, I did not get any money for, but the rest, it was covered. So I was like, approaching older age. Anyway.
Yeah.
Okay. I gotta go pick up my kids. I gotta get my kids from school.
We're gonna end. Thank you guys, everybody who's here. Okay. Thank you, Liz, and for the tutorial. Appreciate Lori, Scott, Mr. Midwife. I'm gonna attempt to do this outro, which I've never done before. We're gonna see how this works. Do I have to pop you guys off, Scott, to do an outro? Is that
nope,
how it works?
Click that, and while it's running, I think, or right afterwards, then you click end broadcast.
Oh, look, magic!
There you go.
Magic. Got it.
All right. That's great.
Strong work.